Hi everyone, my name is Erica Walda, and today I will be discussing a timeline of history through the United States healthcare system. Starting with the early 1900s, the American Medical Association, it becomes very popular. To give you a really good example, the physician memberships go from roughly about 8,000 memberships to about 70,000 memberships. This really helps with the start of standardization care across the United States. With that care increasing, the medical bills, of course, are going to increase as well. This came for a need for non-for-profit health insurances. These types of plans really helped keep everyone financially safe, and this includes the patients and the hospitals. So, as a need for the physicians and the hospitals increase, we do see an uptick in medical technology. This means new life-saving practices such as anesthesiology, ventilators, and the use of penicillin. World War II begins 1939, and this makes the cost of everything go up. Not only food, but also medical supplies. The cost for the medical supplies being made, the medical services itself, a lot of that was really a lot cheaper prior to the war. With higher prices, we do start to kind of ask who's going to pay for this? And that's really what the non-for-profit insurance groups started asking. With revenue, they were really sending a lot of money out. However, there was nothing going on to help money coming in to assist with keeping up with this inflation. So we have welfare for the poor, we have private health insurances who can afford them, and we also have coverages for sick, for more of a long-term sick situations. So in the 80s, we do see the pricing of drugs go up. Not only the cost to make these drugs, but we also begin to see the hospitals start charging more as well. This was a time where the hospitals really could charge what they wanted. And you could see where that would start to cause some issues. If you went to get, let's say, I don't know, let's say you went to go get a flu shot, right? And you go to one hospital, and let's say they charge you X amount of dollars, but the next year you go and you get a flu shot from a different hospital, and they charge you double. Obviously, you're going to want to go to the hospital that's a little cheaper, but you can see where patients don't know the differences, and the insurance companies are having to pay more money at hospital B than what they are at hospital A. So this is where we kind of see the insurance companies really kind of create this more of like a diagnostic pricing, setting more standardization across the board. So with the way insurance begins to pay, the hospitals become a little bit more detailed in how they are doing their billing. So, for example, they may have just said, oh, okay, this person came in and they had this procedure done, and we billed insurance X amount of dollars. Well, now on their billing, they're probably saying, okay, yes, they did have this procedure done, but we're also going to bill out the use of these surgical supplies, X, Y, and Z that was used. They're going to be a little bit more detailed in order to help recoup a lot of that money that maybe the insurances weren't going to pay based off of that diagnostic standardization pricing. Drugs were able to start being advertised. We see later in the 90s. This really took off to where we had specific medications being very highly advertised and prescribed more and used more than a lot of other prescriptions. So you can see where the healthcare industry really is advertising a lot of those drugs, but they're also making a lot of money on specific drugs that are advertised because they're being asked for, they're being utilized. Physicians are really prescribing specific medications. This is where the hospital pricing really takes off. And really where you kind of see more of what healthcare is today, where we have our insurances, where we have contractual adjustments, we have our deductibles. Really, they nickel and dime every specific thing you can think of. When they go for billing the insurance companies, billing the patients, everything is broken down to make it more relevant and to assist with recouping a lot of that money. But at the end of the day, the healthcare industry is really about providing the services and recouping the money that it does take to provide those services.